Are you consuming more alcohol? Feeling depressed, lonely, or isolated? Maybe even having less sex with your partner? Well, if you are not alone. More than 42% of Americans have reported symptoms of anxiety and depression as we move into the second year of the pandemic. From healthcare professionals to teens, Americans are stressed, and the fallout of the pandemic is impacting every aspect of life as we knew it before this time last year. Today, we are talking to experts to help us make sense of our pandemic blues. All coming up next.
Live from Los Angeles, this is the Special Report.
Disneyland, Universal Studios, indoor dining, and the entire state of Texas are all opening up. Yes, Texas is open for business. And as many folks are cheering the lifting of restrictions and are ready to trade their masks for bathing suits, others are cautioning that even though daily new cases of COVID have been declining and at this point are pretty much at a plateau, there is no denying that the havoc wreaked by the pandemic, from millions of lives lost to economic devastation and rising rates of depression to fewer births and nurses walking off the job, people are really concerned about the fallout. Some are cheering the lifting of restrictions, and others are cautioning that we're not out of the woods just yet. And as I said, the impact of the pandemic can be felt in every aspect of our lives. So we're asking, how long is this going to last? Are we expected to live like this, to have these conditions last into perpetuity? We don't know. But today we're getting some answers from our experts. And here for my leadoff panel is Dr. Wendy Dean. She's practiced medicine both as an emergency room physician and a psychiatrist. She's also the co-founder of Moral Injury of Healthcare, a nonprofit dedicated to addressing the injuries, the mental health, the stress, and the anxiety, depression facing healthcare workers across the country. Good morning and welcome, Dr. Dean.
Thanks so much for having me. It's a pleasure to be here.
Oh, absolutely. So glad you could join us this morning. We're talking about the fallout of the pandemic. You know, some folks are cheering that we're turning the corner, and others are talking about what we're going to be left with as a result of this pandemic. And one of the big issues that's been in the news lately is the what's called physician burnout. Physicians are leaving their jobs. Talk to us about what's happening with the medical profession, specifically as it relates to COVID-19.
Yeah, so I think what we need to understand is that COVID hit a healthcare workforce that was already in a crisis of distress. We already had an epidemic of burnout, what we had been calling burnout, which is where we don't have the resources to get our patients what they need. And really what we've reframed it as is moral injury, that we know what our patients need. We can't get it for them. It's not that we're tired. It's not that we didn't know we were going to do hard things or work long hours. What we didn't know is how hard it was going to be to get our patients the care that they needed. So we already had that coming into COVID. And
I know we're going to talk some about, the concept of moral injury, but before we do, I want to ask you about the stress that physicians are feeling. Again, it's been in the news lately. There's also a study out that says 42% of Americans are experiencing stress as a result of COVID. Do those numbers, that 42%, how does that compare with what you're seeing in the physician population?
So actually, there are some studies that have shown it's even higher. About 67% of physicians and other healthcare providers who have treated folks with COVID are experiencing increased stress during the pandemic.
Wow.
And I think that's really translating into a workforce that is worn thin. They've been at this for a year, and vaccines are coming, which is helping, but we need to make sure that everybody gets that vaccine so that we can reduce the strain on the healthcare workforce, so they're there for us when we need them, not just for COVID, but for all kinds of other healthcare emergencies.
And you and your partner, your co-founder of Moral Injury of Health, you coined this phrase. So tell us, why describe the stress that doctors are experiencing as a moral injury?
Well, so we've other researchers have shown that clinicians are very resilient. We knew what we were getting into when we took these jobs. So burnout talks about individuals not being resilient enough, not having enough grit to do their jobs. And what we said is they've got plenty of grit. What they need is the ability to get their patients the care that they trained, that they know those patients deserve. And their hands are tied. Their hands are tied by things outside of their control that keep them from getting their patients what they need.
And speaking of hands being tied, Dr. Dean, there are states like Texas that are saying we're open for business. There are states like, the Dakota, South Dakota, some of the southern states, Mississippi, Alabama, predominantly red states that have taken a very different approach to COVID and some of the safety measures. Are you finding that physicians and healthcare workers in those states are having higher levels of stress than in states where, the governors have taken a more cautious approach?
It is very, very hard for healthcare workers to leave a shift where they're taking care of COVID patients in the intensive care unit. And as they leave their shift, they walk by restaurants and bars that are open. They know they will be seeing those patients in 3 weeks. It is heartbreaking for them to see that simple measures are not being taken.
And what do you hope to accomplish, Dr. Dean, by reframing this issue as moral injury of health, rather than, like you said, just talking about it as stress, which assumes that doctors somehow don't have the resiliency that they need to face that?
I think what we need to do is, in shifting the language, we shift the focus of where the solutions need to happen. When you say burnout, we focus on the individual. The individual needs to become more resilient. They need to develop better skills. They need to do better self-care. When we talk about moral injury, we're talking about changing the system in which those clinicians work, making their work easier, making it less difficult with fewer barriers to getting patients the care they need. And I think in that way, it's a secondary effect. But when you go into work and you know you don't have to fight every day just to get the basics accomplished, it will really do a lot to improve clinicians' well-being.
How is your reframing of this issue and talking about it in terms of a moral injury? How is that being received by the healthcare industry?
It is remarkable how many clinicians will have contacted us and said, oh my goodness, this is the language I've been looking for the past 20 years. It's been out in the world for a hot minute, about 2.5 years, which is no time at all. And we're already starting to make progress in making change and reframing solutions. So I think we're on the right track.
Yeah, I want to bring in my next guest into this segment, but before I do, we have a Women's History Month trivia question. And the question is, and again, you start posting your comments and don't go to Google to look up the answer, because we'll get the answer a little later in the show. But the question is, during the 1918 flu pandemic, there was a severe shortage of nurses. And the question is, what did our government do? Did they ask trained Black nurses to step in and to help? Or did they start a process of using untrained volunteers? So it's an either or question. During the 1918 flu pandemic, were Black trained nurses utilized in our country, or were untrained non-African American volunteers, not nurses, but volunteers, utilized? Okay, now to bring in my next guest, because doctors aren't the only ones who are feeling this burnout or this moral injury of health, as Dr. Dean characterizes it, but also nurses. Nurses are also feeling the heat and the pressure from COVID. And so I want to welcome back to the show Dr. Sheldon Fields. He is a registered nurse himself, and he is the first vice president for the National Black Nurses Association. Good morning and welcome back, Dr. Fields.
Good morning, Areva.
Okay, going into the second year, nurses who for 20 years have been voted the country's most trusted professionals, they're running pretty empty. And reports are in the media that some are even giving up the profession. So what's driving this departure from this most trusted profession? What are you hearing from your nurses, Dr. Fields?
We've heard from our nurses from the very beginning who are on the front lines of the pandemic because, nurses had no choice. And we don't get to choose our patients. It's not in our moral ethical code. So nurses have always been there. But if you also remember, Areva, at the very beginning, nurses were working long hours without the appropriate PPE, literally sacrificing themselves, and then going home to some of the very same inundated communities. So there wasn't a break. There was a lot of stigma involved. And you remember we talked about this before, like, when the nurses were on the front lines of the HIV epidemic choice, that the nurses also felt that. It's been absolutely exhausting. We heard that from our nurses very early on, and we tried our best to, set up ways to support them, give them emotional outlets. The National Black Nurses Association did a partnership with the Pfizer Foundation, and we set up a whole website where people called Nursing Reset, where we tried to really hone in on the mental health of our workforces, our nurses. They got free counseling, mental health support through this program, which was very necessary. But you're absolutely right. Some nurses felt betrayed by their jobs in their profession because they weren't given the help that they knew they needed. Dr. Dean was very much right on point when she was talking about, being there, knowing what we needed to do for our patients and not being able to. And sometimes the best thing that you could do was to hold a patient's hand and get some type of, Zoom or electronic, so they can talk to their family members as they literally took their last breath. Yeah. That was hard to see day after day after day.
So, I guess it's funny, Dr. Fields, you think about those images in the early days of the pandemic where people were out on their balconies and they were cheering for nurses and people were holding up signs. And, there was this sense that the country was appreciating and embracing what was going on with nurses. And so you're saying was that all, performative or it wasn't translating in terms of their actual, work environments?
Right. That type of community support was very much there. The community did support the nurses. They supported the physicians, all the essential healthcare workers. They really did feel that support. But to the extent that it was translating into some of the places where people were working, it did lag. And as you pointed out earlier, it lagged by state. Workers in states with more progressive, state governments or, governors that were willing to adhere to the science and pay attention to what, Dr. Fauci was actually saying at the time, as compared to, being caught up in the political determinants of health, Areva. We talk a lot about the social determinants of health. Let's really talk about the political determinants of health that will really driving some of the decisions that we saw being made by some of those states that you mentioned earlier in your conversation with Dr. Dean.
So, Dr. Dean, what is it going to take? If nurses are leaving their profession, if doctors are leaving their profession, if it's well known that they feel that the profession feels unsupported, we know we couldn't have gotten through this pandemic without the dedication, hard work, and commitment of doctors and nurses and hospitalists and others in the medical profession. Why isn't that translating to the CEOs and the C-suite executives of these big health systems and health plans?
So what I really think we need to do is come together as clinicians and patients and say, our values are aligned. We all want the same thing. And now we need to raise our voices and talk to the C-suite and say, we also need to get you on board and get your values aligned with ours. And I don't think it has to be an antagonistic discussion. I think we can all come together. We all want people to be better than they are, and we want medicine to not be so hard. But we all need to come together to co-produce that solution.
Are you seeing, Dr. Fields, those conversations starting to take place? Or do you think nurses are being heard? And before you answer, let me just tell you one thing I did before I came on. I was listening to the Biden task force on coronavirus. And these task force meetings are very different than what we saw, 6 months ago when they were being run by Pence and Trump. This is actually the scientists talking to the American people on a virtual conference, and reporters are allowed to ask questions. And so just listening to it, I got a sense that the medical profession was responding to what was happening on the ground. Do you get that sense as being a leader of a national, organization of nurses?
Yeah, we are getting that impression that they are listening. At the very beginning of that COVID task force, there wasn't a nurse on that task force, Areva, and the nursing community, the nursing leaders around the country, we galvanized, and they heard us. And they did appoint, there is now a nurse on that task force. The Black Coalition Against COVID is meeting with the task force as well. And the National Black Nurses Association is a part of that task force, along with, the 4 historical Black medical colleges, so they are listening. And I think there is a lot of conversation going back and forth. And they really are understanding what the needs are. But, specifically when we talk about nurses of color, and I really want to make this point, the nurses of color also were dying at higher rates. And again, going back into the very same communities, because they lived in those communities that were also disproportionately impacted. So there was this double whammy that was happening specifically, at least with nurses of color. I want to really acknowledge Dr. Ernest Grant of the American Nursing Association, because they have now moved to stand up the commission to study racism in nursing, to get beyond some of the fact that we were also dealing with a healthcare system with structural racism, that it has to be a part of this conversation going forward as part of our way through it.
Mm-hmm. And are you concerned? And one, I should say first, I don't want to gloss over that. That's huge and significant. And this is the day that the George Floyd trial was scheduled to begin. Yes. It was delayed because of an appellate decision about adding one of the charges back. But when you think about George Floyd, obviously it's about justice for George Floyd and his family, and accountability for the police officers that kneeled on his neck for nearly 8 minutes as he cried out. But it's also, his murder sparked a much larger conversation beyond policing and a reckoning of so many systems, particularly looking at systemic racism in our healthcare system, in our criminal justice system and other systems throughout this country. So at this moment when we're having those conversations, I'm so happy to hear that conversation is happening as it relates to the nursing profession. Because you're right, Black nurses of color, may be heroes in the hospital, but when they go back into their communities, they face the same levels of systemic racism that yes. individuals who are not in the healthcare profession face. So glad to hear those conversations are happening. I do want to ask you, Dr. Dean, though, about this opening up. So, the CDC is saying vaccinated people can now have small gatherings with each other. Don't have to wear masks, don't have to socially distance. And there was this sense this morning from the press conference, the coronavirus task force conference, that we are turning the corner. But there are a lot of experts, you don't have to look far to find those epidemiologists who are saying, wait, don't go so fast, because we've actually plateaued now. 60,000 people a day are still being impacted, and we're still around 2,000 deaths a day. So the numbers have come down substantially, but we are not, by some epidemiologists, out of the woods. So do you have concerns about Disneyland? I was just in St. Louis, Missouri, a red state, and the restaurants in St. Louis never really closed indoor dining, very briefly. But I was able to go into restaurants, and I'm fully vaccinated. But I was around people who weren't. And there wasn't a sense that this is still a very infectious virus. So do you have concerns that we are moving too quickly and we could overwhelm the health system all over again?
Yeah, so I think that's a fabulous point, that the whole reason for all of these measures was to not overwhelm the healthcare infrastructure. The problem with opening up so fast and not doing it in a gradual way is that we still risk not just overwhelming the number of beds in the hospital, but overwhelming our healthcare professionals who are exhausted. And so I would like to see a measured open rather than just blowing the doors open and letting us all do what we want to do.
Run to Disneyland.
Yeah, I mean, give us a minute. Give us a minute to catch our breath and, be ready to take care of you again. But we're not there yet.
Yeah. Is that your sense too, Dr. Fields, that this opening of amusement parks, they're talking about stadiums and professional sports being able to welcome spectators back into stadiums and indoor dining and bars and nightclubs and restaurants and, just saying we're open for business. Do you have any concern, leading, tens of thousands of nurses, that the nurses will feel like they're being overwhelmed all over again?
Yeah, I share Dr. Dean's, concerns, because you also know, and we've been talking for months about the disproportionate distribution of the vaccine, and in people of color communities, even with nurses of color who have a certain amount of skepticism. We talked about that. We got to give people a little bit more time to get the vaccinations, get a certain amount in. We're being promised by May we'll finally have enough for every adult. We're not there yet. The moment the Biden-Harris administration announced their plans, Texas and Mississippi were like, okay, throw open the floodgates. Literally like an hour after that conversation by President Biden. That should not have happened. I'm skeptical, but I'm hopeful we'll get there. I want to go out too, but we gotta give ourselves the opportunity to get there.
Yeah, it's kind of interesting because that 2,000 a day dying number, we have to put that in context. When 2,000 people were dying at the beginning of this pandemic, we were sounding the alarm.
Mm-hmm.
That was causing us to sound the alarm and to take, precautionary measures. Now we are almost accepting that 2,000 number as something to celebrate, something to say we're turning the corner. It's no longer causing us to be alarmed. And your point about the disproportionality, even in the vaccine rollout, continues to be true. Like I said, I was in Missouri over the weekend, a red state, spoke with one of the highest ranking elected officials in the city of St. Louis, which is predominantly African American. And she said even, a Black person in St. Louis was having to drive out of town 2 to 3 hours to rural parts of the state because the governor, while he criticized Biden, was also placing vaccine clinics in rural parts of the state that were not as nearly populated as St. Louis or Kansas City. Vaccines were not being utilized and people were having to drive. So there's so much politics still happening with the vaccines. And I asked her, why does she think that was happening? And she says, because St. Louis and Kansas City are not where his base is. That you can be the Republican governor for the state of Missouri and never really even deal with the Black folks in St. Louis or Kansas City, just deal with white people in rural parts of the state, which is, an atrocity that African Americans are having to travel outside of their community for 2 hours to get something which should be right in the heart of the community that has been hit the hardest. Before I let you both go, we've got to get an answer to our women's trivia question about Black nurses. I'll give that one to you, Dr. Fields. I'm sure you know this answer. The pandemic of the flu in 1918. Lots of Black nurses were ready and willing and able to work, but what did this governor do?
They went to the volunteers. Structural racism in our healthcare system didn't just happen, didn't just start, Areva. It's still something that we contend with on a daily basis. It's why the National Black Nurses Association, our colleagues in the Hispanic, Nursing Association, the Filipinos, all of the groups under the National Coalition of Ethnic Minority Nursing Associations do the work that we do specifically in the communities where we live, work, play.
Yeah, and you're right. Even though Black nurses were raising their hands saying, put us in the game, untrained volunteers were utilized. Eventually, 18 Black nurses did serve in the Army during the pandemic. And we actually have one of the nurses that's been on the show before. Her name is Erica Field. She's here. And I want to bring her into the conversation before I let the two of you go, because she's been on the front line working with COVID patients. And I always think it's important to hear from those people who are having these lived experiences. So Rashad, is Erica here? Can we bring her into this conversation? Oh, okay. Maybe I thought she was, okay. She's getting set up. There she is. Good morning, Erica. How are you?
I'm okay. I'm sorry. I'm kind of late, but
Oh, that's okay. You're here. That's all that matters. I wanted to talk to you again because you've been, gracious enough to share your views with us on the show before about what was happening where you are working on the front lines with COVID patients. Tell us how you're feeling now. Are we having, Rashad, some technical difficulties with Erica? I thought I saw her. Okay, I think we dropped her connection. I don't know if we're going to be able to get her onto this, but I wanted to talk to Erica because she's been on the front lines and just kind of, taking the temperature of how nurses who are working with COVID patients are feeling about this opening up and this fear that we know many of them have that they're going to be inundated in the way they were just 6 months ago or so. But thank you so much, Dr. Fields. Always, your insights are invaluable to this conversation. Thank you, Dr. Dean, for helping us reframe how we should be thinking about what's happening to frontline medical professionals. We'll continue to follow this story. And again, thank you for joining this morning.
Thank you for the opportunity, Areva.
Thank you so much.
Medical professionals aren't the only ones reeling from the pandemic. America's teens are facing a mental health crisis. Joining me to discuss is Dr. Kirleen Neely. She's a licensed psychologist, a lecturer at St. Mary's in San Antonio, Texas, and the author of two books. One is Straight Talk, and the other one is Mental Health 101 for Teens. Also here is Kathryn Ely. She's a therapist and founder of Empower Counseling in Birmingham, Alabama. She is the host of the podcast Imperfect Thriving. Good morning, Dr. Neely, and good morning, Kathryn. Can't have a conversation talking about the, kind of the aftermath or the impact of COVID without talking about almost every day there is a story about our teens and how hard they have been hit in terms of isolation, depression, anxiety. Tell us, Dr. Neely, what are you seeing in your practice in terms of what's happening with teens and COVID-19?
Absolutely. Well, thank you for having me. I think that to sum it up, our teens feel robbed. They feel robbed of the big things, walking across the graduation stage. But I think more importantly, we miss this. They feel robbed of the small things, sitting in the cafeteria, hanging with your girlfriends, talking, the first time the boy flirts with you, all of those things that from a social, emotional development aspect is how you grow and you learn. And so they're missing out on just, being able to thrive and do those simple things that we all took for granted.
Yeah. I was really shocked, Kathryn, to see a study that said that self-harm and overdose, teens overdosing on drugs was skyrocketing. And the age group, it was the young teens as young as 13, that age group between 13 and 18. I read a report that said the overdose jumped by almost 94%. Are you shocked by those numbers?
I'm honestly not. I'm saddened by them, but I'm not shocked. If you look at the stage of human development that teens are in psychologically and physically, what they need the most is peer interaction. They need to be finding out who they are by interacting with other kids their age. They're not able to do that. They're stuck at home with their parents or going to school and having to distance from them. So they're really missing that level of connectedness that it takes to form their independence and figure out who they are.
Yeah, and Dr. Neely, consistent with those studies about overdosing, there's again a shocking study about teens and suicide, that the suicide rates by teens have increased by some account by as much as 67%. Again, in teens, and this was even a preteen age, they looked at 12 to 17-year-olds, and this is during the period of 2020. kids, it's so hard for me to understand as a parent of three. And thank God my kids haven't had any episodes, mental health crises, or, episodes with suicide. But to think that a 12-year-old who, is just a baby is thinking about suicide.
Absolutely. The rate of suicide has always been high, but obviously the pandemic has put it on blast. And, Areva, just like you, I have a 13-year-old and a 15-year-old. So I'm feeling it on the ground. And even my kids, even though their mom's a therapist, they're struggling. They're struggling with isolation. And when we look at isolation, we look at it's tied to depression. The more isolated you feel, usually the more depressed you're going to feel. And so you start to kind of validate your own thoughts. If you were thinking, well, you know what, no one likes me. If you were thinking, well, maybe I'm not that cute or whatever it was, you now validate it because you don't have a girlfriend at school to say, oh my gosh, you're beautiful. You look great today. And so it is super, super sad. And, I think the thing, though, that I want to highlight, I feel that the pandemic has brought mental health to the light. A lot of times, we weren't talking about these things, but these numbers have been here. They're just, a little bit bigger now. And so I'm happy that out of this, bad thing, maybe a good thing can happen, and we can really start focusing on mental health, especially for our adolescents.
And so, consistent with that, Kathryn, as a parent and parents sitting at home watching this, what are some of the warning signs that your child may be overdosing on drugs or contemplating suicide?
Yes. So, what comes first before the suicidal ideations is anxiety and depression. So we really want to be catching it early and looking for signs of anxiety. Anxiety is consistent worry, which in teens and children can come across as being just irritable, particularly irritable, moody, not sleeping, staying in their room too much. All of these things, when you see a marked difference in their habits, it's time to really pay attention.
And what help is available? I saw this report, Dr. Neely, that said a lot of teens were reporting to emergency rooms, and that emergency rooms are not equipped to provide mental health care to teenagers. Most of them are there patients who have acute physical conditions, and getting them stabilized. And if they're having some kind of psychotic condition, to get them to some kind of facility that can address it. But if you are at home and you feel like your teen is having some kind of a crisis or exhibiting some symptoms, where can parents turn?
So, of course, they can turn to, there's a lot of 1-800 hotlines for teenagers. And so parents can turn to those lines. But I want to back up a little bit. I think before that happens, that parents have to have the mentality that let's talk less and listen more. Because you'll never find out whether that teen needs to get access to maybe a mental health professional or their physician, whatever it is, if we're so busy talking. Sometimes, and I'm a mom, we get wrapped up and we're busy and we're trying to do our thing. And so we forget that kids will open up and tell us a whole lot if we'll just listen. But I think that seeking help from a local mental health professional is a good idea. Also, like I said before, there are always, great 800 numbers and hotlines for teenagers. The American Suicide Foundation has a great hotline that kids can access as well.
And how do parents, Dr. Neely, parents are super stressed themselves. We're just talking about teens, but the earlier segment, we said, 42% of Americans felt enormous stress as a result of the pandemic. And, it's affecting our relationships. A lot of families are having food insecurities. They're dealing with being laid off from their jobs. So there's the economic impact. How can adults, prevent the stress that they may be feeling from being transferred onto their kids? Because I have to imagine, in addition to some of this isolation you're talking about teens are feeling, they probably are taking on the stress that's happening in the household. If they know mom and dad aren't working, if the lights are off, if the cable gets cut off, if they know mom and dad is standing in a 5-hour food line, all of that stress has to be impacting them as well. But how do we as adults, try to keep that grown folk stuff away from our kids?
We got to deal with ourselves. You got to look in the mirror. You got to really stop and ask yourself, how am I doing? Because sometimes, as you said, because we get wrapped up into trying to do everything else, we don't slow ourselves down to say, how am I doing? And maybe I need that extra 10 minutes in the shower today. Maybe, it's a little small walk around the neighborhood. If you don't take care of yourself, then your kids are going to feed off of that. I like to say you can't give them what you're not giving to yourself. So it really starts very small, very simple, and kids can read us. all the time, we're talking, they're studying us. They're studying how we're handling that phone call, that Zoom. How are we dealing with all of that? So you are constantly modeling for them how to handle stress and how to cope.
Yeah. And Kathryn, how important do you think getting back to school is? We know that this CARES Act was just passed by the House and the Senate. It's going to go back for a revision to the House, but there's tons of money now that's going to be made available for vaccines as well as schools so we can get kids back to school. In some big states like California that haven't had in-classroom school is hoping to be in that position by April. So getting kids back on campus, how significant will that be to addressing some of these issues of overdosing and suicide that we're seeing amongst teens?
I think it's absolutely huge. When you're online school and you're at home and you're by yourself, it's very difficult to not only focus on the subject matter and the teacher, but it's very easy to get lost in your own thoughts in your head. And all of those what ifs, and teens are very prone to all or nothing thinking and catastrophizing, which is part of the problem. They think in extremes, which really causes anxiety and depression. So getting out of their heads and physically into school with their friends, with their teammates, with their teachers is going to help them focus on the positive and focus on what is important to their future and get them out of their own heads and the what ifs and all of the catastrophizing that's going on now.
Well, great. We're going to provide some resources on our website and on our social media about, crisis hotlines and what parents can do. I want to move on and talk about another impact of the pandemic, and that's drinking. Other fallout, retailers are seeing a 30% increase in sales of liquor. People are drinking more as a result of the pandemic. These spikes, unfortunately, are happening mostly amongst women. A new study by the Rand Corporation compared adult drinkings from 2019 to 2020. They described binge drinking as 5 or more drinks for men and 4 or more drinks for women. And they say women are drinking 4 or more drinks in a couple of hours. Again, Dr. Neely, does this surprise you that the Zoom happy hour is what they're telling us to all do, but then they're saying, well, wait a minute, you're taking that too far and you're having too many drinks?
Yes. And it doesn't surprise me because, women, we usually take on the brunt, right? Anytime there is a major thing going on, we're the ones that are usually taking on the brunt of what's happening in the household. We've also been driven out of the workforce, right? And so if you think about why women may be drinking more, number one, the job that I used to have is gone. Maybe I have it, but I can't keep it because I need to be home to take care of the little ones. And so the stress for women is just 10 times, it's tenfold. And we are not really addressing that. It is not equally distributed. Men, a lot of them have not had that same level of pressure that they have felt to keep it all together.
Mm-hmm. How do you know? What are the warning signs that definition of, well, first of all, do you agree with that definition of binge drinking? That if you are a woman having 4 or more drinks within a couple of hours is probably an indicator of binge drinking. What should you be thinking about, particularly, like I said, lots of jobs even are inviting you to these Zoom happy hours. They're sending you a bottle of wine. A lot of online fundraisers are sending you bottles of champagne to, enjoy as you Zoom away with friends and colleagues. You're to be sipping a glass of wine or champagne or a mixed drink. We've had mixologists on the show that could, show people how to make fancy cocktails. But what should you be looking for yourself as maybe an indicator that you're drinking a little too much?
I always like to say it's that urge, right? That urge where you're waking up and you're thinking about it, or you can't wait for that 5 o'clock. You can't wait. Soon as I turn off this Zoom, I'm getting my bottle, right? So those are those indicators, and I also want to be cautious because sometimes, you may have a day, a night where I have a few, but that doesn't mean that you have a problem. It's consistency. If that's something that's happening frequently and consistent over day, then you really need to stop and say, hey, wait a minute, this is not in that normal range. But I do agree with the number that you quoted.
And Kathryn, we know that a lot of people in recovery from, alcohol, substance abuse are told not to isolate themselves. But the opposite, is true in COVID, where we are told to isolate. With the vaccine, we've been given the green light to do a little more socializing. But for the most part, for the last year, we've been told, stay in the house, don't go around people. So how does that impact someone that perhaps, has a substance abuse or alcohol they're dealing with the disease of alcoholism and they're trying to recover.
Yeah, that's been another really difficult part of the pandemic is people that need treatment for their different issues are not able to get the treatment they need. So what's important for those people to do is to find other ways to deal with the stress and to deal with the urges. Studies show that just getting out in nature. So it's more about getting away from this all or nothing thinking of, if I can't go to these meetings and I can't do this, then I'm in trouble. It's what else can I do to not drink, to not use substances, to relieve stress. And studies show that getting out in nature is one thing that's very helpful for that. And we're not limited in that aspect.
Right.
We can go kayaking, we can go paddleboarding, we can go for a run. So I think it's being aware that there isn't just one way to address an issue.
Yeah. And, if you don't have access to a lake or a river or that kind of equipment, you can just walk around the block in your own neighborhood. It's safe, it's free, wear your mask. But, you don't need any special equipment. You don't have to get in your car and drive for an hour or 2 hours away. Dr. Neely, you said you weren't surprised about the drinking numbers. Are you surprised about the babies? So we're not having a baby boom, we're having a baby bust. Women are not having babies during this pandemic. Now, this one shocked me because you think intuitively people are at home more. They're spending more time with their spouses. You have more time on your hands, and maybe that more time means more intimate time together. But what's going on with babies in this country?
Well, you know what? I love this one because what I see is that, problems that were already there are highlighted now. So if you are already kind of having that little bit of stress with that person, but, you guys had 8 hours away from each other, now that you are home, you kind of figure out, you know what? I really don't like you. And so I'm not surprised that a lot of couples are really struggling. We've also seen an increase in domestic violence as well. And we really have to note that. So there are some systemic issues that families were dealing with, but they were covered up. We could kind of gloss it over. Now, guess what? It is on blast. It is here. We're in the house 24/7. I can't get rid of you. And so I think that's why maybe we've seen a decrease. Also, back to women drinking. I think women are struggling with figuring out, who am I now? Who am I now that I don't have that job? And when you're depressed, you're going to be less frisky. You're going to be less, willing to want to play around in that way.
Yeah, and the studies also show, Kathryn, that women are delaying pregnancy because of, the pandemic and the economic fallout. Many of them have lost their jobs, or they have fear of losing their jobs. There's concern about giving birth in a hospital where maybe you're not going to be able to have visitors. You may not be able to have your family members over to provide that initial support when you come home with a new baby. And I was shocked to see in 2021, we're expecting in this country 300,000 fewer babies to be born. Any advice you would have to women who are, just trying to decide, make that decision about, get pregnant, not get pregnant during the pandemic?
Yeah, I would say as many negative what ifs as come into your mind trying to prevent you from doing what you want to do. Give yourself some positive what ifs and really focus in on what you value and what's important to you. It's very easy to get caught up in the fear, right? The fear of everything that can happen and everything that can go wrong. Our minds are very interesting that way. They're trying to protect us, right? But our minds never seem to give us the positive what ifs. What joy can I gain from adding to my family? How can this bring my husband and I closer together, my wife and I closer together? So I would say really dial in, try to move away from your fear and dial into what you value, what you want.
Great. Well, obviously you can't have babies if you're not having sex. And it turns out that couples are having less sex during the pandemic. Again, not necessarily intuitive. I think the intuitive thought would be home more time, more freedom, more sex, but not true, Dr. Neely.
Yes, absolutely. And I think I go back to what I said before. I think that the pandemic has just highlighted issues that were there before. And so if you're struggling already and now I'm with this person, I'm going to be probably less likely to connect with them. But I do believe that hardships are a test of our resiliency. And so as couples, we really have to talk more to each other. We really have to slow down and say, how can we connect in the midst of all of these things? Because that is the base of who we are. And so I hope couples are listening out there, and I hope they're kind of maybe stopping and realizing that, let's use this as an opportunity to connect as opposed to disconnect.
Yeah, one of the things I saw, Kathryn, that's leading to this less of sex, clearly, as Dr. Neely said, people are realizing they had problems in their relationship, and spending more time together isn't necessarily the cure for those problems. But also a lot of women have gained weight. A lot of people, but again, we're talking about women, have gained weight and are feeling, less sexy, less attractive because they picked up, the COVID-15, the COVID-19. And their self-esteem has been impacted by this weight gain. Again, how can women, obviously there's some things they can do physically to address the weight gain, but what can they do to address what may be feelings of lack of self-confidence that might be fueling their, lack of desire to have sex?
Yeah. So once again, I would say really gain clarity in the different areas of your life about what you value and start taking action toward that. Because when you do, your self-confidence and self-esteem goes up. So if you're not where you want to be physically or mentally, look at the domain of mental and physical well-being, set some goals that are in line with what's important to you and start taking action toward them. Then look at your intimate love domain and say, what is it that I value here? What is important to me here? What actions can I take despite what's going on in the other domain to get closer to my significant other and sort of get over myself when it comes to that?
And Dr. Neely, how long do you think we're going to be under this kind of cloud, I'll call it? All of the things we've talked about, the fallout, the impact of COVID. Do you see, as we turn the corner on the vaccines, as we're starting to reach herd immunity, do you see things starting to change as it relates to our mental health? Or do you see a day and time, and not necessarily an exact day, but a period when we start to feel better about ourselves and less stressed and less anxious?
I hope so. I hope that we are, kind of moving around that corner. But the truth is, we don't know what we don't know. We do not know how 5 to 10 years from now, what is happening today is going to impact the long-term stress on our mental health. Back to when we were talking about teens, a lot of these kids have lost aunts and uncles and mothers and fathers. And so the grieving process is just beginning for them. Once we're able to go out in public, they're still dealing with that person is missing from my life. So I don't think we know right now. I think what we can do though is put some protective factors in place, make sure we are talking about mental health, make sure we're getting our couch time check-in, as I like to say. There's nothing wrong with going and sitting down just because you want to process, and really promoting that for our children, because we don't know where they're going to be in 5 to 10 years, what's happened today.
Yeah, and Kathryn, we're talking a lot, we haven't used the word a lot, but stigma, big issue in the mental health profession. Do you feel like the focus and emphasis on mental health issues because of the pandemic is breaking down some of that stigma that prevents people, particularly people of color and different cultures, from seeking mental health care? I know most health plans now, you can, call up your therapist, you can do teletherapy sessions, but do you think we're really making headway with the whole stigma that often prevents people from seeking help?
We're definitely not where we need to be. The virus has disproportionately hit Hispanic and Black populations, but Black and African American individuals are less likely to seek help. Studies show that 63% of Black individuals believe that a mental health condition is a sign of personal weakness. So as a result, that person is not going to seek help, right? I think where we have a huge opportunity here is within our businesses and our companies. I think we need to establish mental wellness programs. So many companies have all sort of physical guidelines and physical safety in place, but no mental wellness programs. In fact, studies in Canada and Australia show that businesses get a return of investment on every single dollar they spent on mental wellness programs in their companies, and America is very much lagging behind. So since we spend so much of our day at work, we need to create these cultures at work where it is okay to seek help. It is okay to talk about mental illness, and the programs necessary to keep people well are put in place at work, and they're supported when they're not well.
And final question to you, Dr. Neely. Talk to Black folks. What Kathryn said is true. Many African Americans, see seeking mental health as a personal weakness. Many believe, as long as I know Jesus, that's all I need. That God will fix it all. So speak directly to Black folks and tell us what we need to hear for those of us, all of us, who have somebody in our family that's struggling with the mental health issue. We may call them, crazy Uncle Joe, or we just jokingly say that person's crazy, and we don't embrace the science and the reality that mental health is an illness, and not something that we can just pray away. We can't pray it away. So speak to us.
Absolutely. I think the first thing is that your mental health is part of your physical health. And if you're, taking care of your diabetes, you're taking care of your high blood pressure, then you have to put your mental health on the table. I think we can look historically, just as a people, how this has impacted us. It is time for us to be on the preventative side of this thing, and we can do it. And you know what, Areva, I'm going to go a step further, and I'm going to call our pastors out. Because a lot of times within our community, in our churches, we are kind of in a soft way told that if you're going to that psychologist, or if you're going to that therapist, that you don't believe, that you don't have faith. And I think there's a place for faith and a place for counseling and therapists. Hopefully, God has empowered me with my skills to be able to help. And so we have to start at where we get a lot of our resources, which is in the church. And I want the church to step up and to speak to us in a different way about our mental health. And I think that is going to be the change.
No, that's so true. It just reminds me of a story I was telling to someone recently. My son is on the autism spectrum, and I started this nonprofit that sponsors this talk show. And when I started the nonprofit, I would go into Black churches and speak about what was going on with my son. And I had this woman who raised her hand at one of these sessions and told me that her pastor had just told her that her daughter had autism because some sin that the mother had committed, and it had her so traumatized that she was thinking of putting her daughter in an institution. She was, really internalized what he said. So here I was starting the nonprofit Special Needs Network, and trying to reach out to the Black community, and going into churches and having someone said it was in a church that she was told that she was the cause of her daughter's autism. Now, I'd like to say that the church I was in was an enlightened, not a part of that, church ministry that would say something like that, because they had invited me in to talk about it. And Special Needs Network, we work collaboratively with lots of Black churches around the state of California and even nationally. So we know that there are many Black churches that have become incredibly enlightened around mental health issues. But to your point, Dr. Neely, there's so much more work to do in our churches, in our communities, in our own families. And so this is a wake-up call for all of us that this stress is real. 42% of Americans, that's a whole lot of people, are feeling stress, and you don't have to go it alone. There is help out there. There are organizations like Special Needs Network. We have a 24-hour hotline that can help individuals. There are suicide hotlines, as you mentioned. Your healthcare plans have hotlines. And if you are listening to us, or you listen to us later, know that there is help available to you. Thank you so much, Dr. Neely. Thank you so much, Kathryn, for sharing your insights with us this morning as we talk about the fallout of the pandemic. Again, thank you for joining us.
Thank you for
having me. Wow, what an interesting show. Glad to be able to talk about, as we are thinking about going to Disneyland, and yes, I'm not going to discourage anyone from going to Disneyland. I am going to encourage people to get vaccinated wherever you are. I was scolding some of my relatives and friends at home in St. Louis, my hometown, about not being vaccinated. And there's still vaccine deniers out there. There's still COVID-19 deniers. People who don't even believe the virus is real. People who say to me they have to do more research. I'm like, research? Have you been under a rock? How much more research do you need? Turn on the television, pick up a newspaper, turn on the radio. The top experts, the top scientists in the world. Watch the special report. We've had some of those top experts. We didn't just have them. We have them on a regular basis. We just had Dr. Sheldon Fields. He's one of the top nurses in the country. He runs a big organization of nurses. We just had, Dr. Wendy Dean. We have Dr. Peter Hotez. We have, Paul Offit. We've had the top epidemiologists and scientists on this program talking about the vaccines and the virus and telling you everything you need to know. And I was just sharing with my production team, Russia is involved in spreading misinformation about this virus. So if you're getting your information, on the internet, check the source and know that there are people out there that mean you no good, that are out to do you harm, that are trying to, sell you on false information that will be harmful to you and your family. If you have questions about COVID, if you have questions about the vaccine, check with your doctors in the same way that you heard Dr. Neely say, if you have diabetes, you're going to go to your doctor. You're not going to WebMD for treatment. And likewise with this virus, if you have questions and you don't believe me or my experts on the special report, call your own physician and they will tell you, one, the virus is real, and two, vaccines work. And they are incredibly, incredibly safe, and they will change your life. I just took my first flight. I flew to St. Louis. I had 2 layovers, one going, one coming back. I felt completely safe as someone who's been fully vaccinated for over 6 weeks to take that trip and to be able to look in on relatives and do a little business while I was there as well. So if you have not, when your time comes, take the vaccination. Okay, some words to live by before I get out. There is no rainbow without rain. Neither military power nor wealth have the ability to stop the destructive spread of COVID-19, and its full human impact won't be known, as Dr. Neely said, for years to come. Economists, though, have told us that the fallout will haunt our economy through 2030, and it will cause us to lose $8 trillion in consumer spending. So as we continue to assess the impact, one thing is clear. To survive a pandemic, we need strong leadership. And hopefully we finally have that kind of strong leadership at the national level. But we need it at the state level. We need it at the local level. And we also need a well-functioning health system, one that prioritizes mental health care for teens and adults. And while we focus on coping with the immediate effects of COVID-19, there are 2 important lessons that I think we can all learn. One is prevention. Prevention is better than a cure. We must learn to listen to the science. We have to listen to what the science and scientists have been telling us. And they have long warned us about this type of infectious disease. And what did we do? We ignored their warnings. And now we are suffering the consequences because we didn't listen to the scientists. Number 2, global threats need global collaboration. See, diseases are problems without passports. They can't be stopped at the border, and they can only be tackled if we cooperate locally, nationally, and internationally. Because as I always say on the sign off of every show, we are all in this together. Don't forget to wear your mask. Be safe out there. I'm out.